Hello, chiropractic achievers out there. Dr. Joe Borio coming to you from Chiropassion headquarters here in Fort Lauderdale. I wanted to talk today about care plans. It's a conversation that is a little bit all over the board, certainly in the profession and all over the world. I work with chiropractors from Australia to the UK to different areas in Europe, Peru, Canada, and then even in the United States. And so sometimes it could be a hot topic, right? And then sometimes it's the doctor. Many times there's a conflict between what their heart says, what their head says, and what they're able to apply within the practice. So it's some of that comes down to skill sets, communication, conviction. Sometimes, docs, and I totally appreciate this. You're in a place where, things are moving forward, but maybe they're a little tight, and you're like, geez, I really want this person. They really need this care. I really want this person to follow through with a certain protocol. I think that's so important. It's critical for them and their overall health, but I don't want to scare them off. I don't want them to not come into the practice. They need it. I'm scared to scaring them off. Maybe you're in a place from a financial standpoint where you're like, geez, I don't want to rock the boat. I mean, obviously they need care, but my expenses are tight. So I want to open up that window, if you will, that doorway, and try to accept everybody to come in. That could be a challenge. Sometimes it's a vantage point, a viewpoint. Like, what's your perspective? What is your perception? What is your objective? What is your intention? How I look at all that depends on where I'm sitting. So if I'm sitting here looking out at a problem or a situation, depending on what I'm trying to get done, determines what I'm willing to do and how I'm willing to approach it and how I'm willing to, many cases, attack it. So let's talk about care plans. One is, what is a care plan? A care plan is going to be a structured format that brings accountability to one's progress, to one's care. Now that can be written and justified from the intention of the doctor, right? Or the intention of an objective of the patient, the practice member, right? Sometimes they're in good alignment, sometimes they're not. So a patient may say to you on day one, look, are you going to crack me today? Are you going to get me adjusted today? Like, make it all go away today. I know this thing's been bugging me for 2 weeks, 2 years, 2 decades, but I want you to do something today to make it all better, right? So they have an intention and an objective. Their care plan is one day, right? Make everything better one day. I know I've neglected it and it's my fault, but make it all better today. And then you can have the doctor's care plan, and their perception and objective may be, look, I want to get them out of pain. It's symptomatic only. Or their care plan may be that with functionality. Hey, look, I want to get you out of pain. So my care is that is therapeutic, but I also want I want some improved functionality, maybe motion, maybe posture, maybe gait changes, maybe strength. So you're gonna see a few different changes in their objective, right? So, and then other times you're going to have the chiropractor and the patient. Many times they'll be in alignment with that. Like, hey, my objective is overall health. I've neglected something for a really long time, and as a result of that, I have an objective where I want to improve my overall health. And then the doctor, many times, or hopefully, that's their objective and intention. Hey, Bob, I want your health to be dramatically improved, right? I want your health, overall health, to be improved. And so the markers, the intention of that are going to be different. And then you run into what your mindset is, what your skill set is. Hey, I know how to communicate that really well. I don't. I don't have a skill set to, whether you want to call it to sell or to, I like the word lead. BJ Palmer talked about words like conviction, transference of a conviction is what he talked about. When a lot of chiropractors back in the day were feeling like, hey, I'm selling things. And he would be like, well, you're transferring a conviction. I kind of see it the same way. Like, I don't think my math teacher was trying to sell me on calculus. I think that they have a principle of mathematical principles that I was unaware of, and they taught me that. And then after I learned that, I was more apt to utilize that or think that way or apply that to solve problems. So if it's in regard to my health, and I realize, hey, there's intelligence, there's a vital force, there's an energy that's in my body that runs through the nervous system and communicates to all the cells of the body. And the primary function of that spine is to protect it, but when it gets crooked, stuck out of alignment, it interferes with that. Therefore, it acts as an an obstruction to that communication, interferes with that. The body loses its ability of resistance. It loses its body's ability to heal. It loses the body's ability of vital force. And therefore, the body's weaker in a state of subluxation than it would be in a state of no subluxation. So my job would be to clear that, right? And then what causes it would be what? Stress and strain and different types of toxins, emotional and physical and chemical, the things we learn. So because my body's being assaulted by all these stressors all the time, it would be important as a dentist to brush or flush your teeth all the time, not because I have a cavity, but so that I don't get sick, right? So same idea. The adjustment is there to reduce, eliminate, clear subluxation so that my body's resistance is higher and therefore my competence is higher, my biology, my physiology is stronger and better, and therefore I'm going to be a healthier person, not to mention the other neurologic and orthopedic benefits of being adjusted. So those are principles that BJ would say, those are transference of a conviction. So my view is that you're leading people to a better decision. And when it comes to care plans, my humble opinion and what I've experienced, and that's, I think, what I could share with you. I've worked with some unbelievable leaders in the profession, from Fred Barge to Sid Williams to, I mean, it's amazing when I think about it, of these people that I knew and that I spent time with and had a cup of coffee with, and Reggie Gold and Ernie Landy and James Sigafus, along with so many others that really had a profound effect on me and my practice. So when I looked at what my perception and perspective was, it became bigger for them. My intention, my objective was bigger for the people I took care of, the more educated I became. So the more my vision, if you will, expanded, the vision I had for the people I took care of, that vision expanded. So at first it might be, I just want to get you out of pain. Then it might be, well, geez, I want to get you out of pain and keep you out of pain. Then it might be, well, why'd you hurt in the first place? And what else is affected by the spine? Well, geez, your prostate, your large intestine, your bladder, right? So I want to keep those areas. Then I want to prevent the spine from deteriorating because it houses the nervous system. And when the spine gets sick, you get sick, right? And then it was, well, wait a minute, when does sickness begin? And maybe the role would be to prevent them from ever getting sick in the first place. And if the nervous system's healthy all the time, then what else does the nervous system do? It allows you to think and see and hear and taste and touch. And so your nervous system is the interface between what's going on out there and what's going on in here. So just your consciousness, your ability to think, your ability to interact with the world is interfered with. Not just, and not to minimize it with the word just, but not just your pancreas or large intestine doesn't work as well. Your whole being, your whole experience as a human being is diminished with subluxation. So again, that vision grew. So then I was like, well, who needs care? Well, everybody needs care. And how long do they need care? They need care forever. So my care plan went from, again, my experience that I bring to you guys, my care plan went from, hey, you need to be here for a couple of weeks to get out of pain, to, so it went from a 2-week care plan to a 90-year care plan. My goal was to be with you for the rest of your life. because of the tremendous health benefits of being adjusted on a regular basis or checked and cleared of subluxation. And then my attitude was, well, when should you start? Well, you should start when you're born. Hell, you should start when you're developing in mom. So mom being healthy makes a healthier baby. Therefore, the baby's healthier, and therefore, when the baby gets checked early on, less likely to have complications. So maybe the baby starts off on wellness care rather than coming in with neurologic compromise right from the beginning. So that journey changed. The other part of it on care plan was that we don't do this deliberately. I get it, and I don't say this to be diminishing of so many other great educators and communicators out there. I see a hierarchy with care, and that diminishes the value of care on a timeline. So if I start care, well, I'm just using words that we use in our vernacular, right? So that's initial intensive. That's really important. Well, okay, so the value of that care is denoted to be more valuable than corrective care. And then that's viewed more valuable than wellness or maintenance care. So all of a sudden we have the initial care is really important. The wellness care, you can, you don't have to, it's not a big deal. And that's, to me, it screws it up. It flips the value. In other words, what do you want to be? Do you want to be a dentist drill, or do you want to be a dentist? Do you want to be a toothbrush? Which one do you think could have a greater impact on the world? So I could wait till my teeth rot and then get a drill and then address the cavity, right? Which can lead to many other complications, including death, right? Or I could teach everyone to brush their teeth and then nobody gets a cavity, right? So to me, as I went further down again, my experience, my journey, as I went further down the rabbit hole, I realized that the toothbrush was much more profound than the technology and the immediacy and the acute care often presented by a dentist drill. And so same idea as a chiropractor. I'm not saying chiropractic care is not great for somebody in acute, so before I get, hammered here, somebody's in acute pain, adjusting them, is that going to help them? Of course it's going to help them. Is it good for them? Yes. There's no health in crooked. No one's better off crooked, right? I mean, I think we can at least all agree on that. The point is, when do you want to involve yourself? Well, I got to the point where I was like, I want to be the toothbrush. I don't want to be the dentist drill anymore. I want to brush and floss everybody's vertebrae and spine and nervous system to allow them a better interface, to allow them a better experience in life, in the world. I found that to be more rewarding, but my perspective, I found it to be more purposeful. How can I serve humanity at a higher level? I could serve humanity at a higher level by being the toothbrush. I could serve humanity at a higher level by leading people that the best care plan is a lifetime care plan. Going back to care plans, right? So you could do a 90-day care plan, right? Which is really popular within the profession. People come in, again, I'm using some words that I don't use, but I hear people say, well, you're going to do like symptomatic close. You're going to close them. I get that. I appreciate that. And maybe for some people, that's a better place for them to start. I don't align with that. My view is that you are already limiting the point of care. Like, you wouldn't trust a dentist that said, listen, get in here, let's brush and floss, let's take good care of them, you got that cavity for 90 days, and then let's abandon what we do, neglect your teeth, and then when they get sick again, give me a call. You wouldn't trust a trainer that said to you, hey, look at, trust is the wrong word, I apologize. The trainer wouldn't have the level of following if the trainer said to you, hey, look at, let's train and work out for 90 days and that's it. Hey, you hit your goals, great. You don't need to do anything anymore. I mean, the average person is like, well, shit. If I don't get in here once in a while, aren't I going to lose everything that we worked and tried to achieve right now? Um, right? I mean, I always say this jokingly but seriously. Like, I get a haircut every month. Like when I leave, which I'm going later today, they're going to cut my hair. Like they made the appointment in a month because they know that my hair is going to grow. Like I'm going to need maintenance on my hair in a month because it's going to grow. So there's an anticipation, there's an appreciation, there's a recognition of innate of biology to go, hey, your hair is still going to grow. It's going to need to be maintained in a month, right? And I think when it comes to care plans, I know your body's going to be assaulted by physical, emotional, and chemical stressors more so now than ever before in human history. From looking at my cell phone to how I sleep to the chemicals, we're talking big about that with the Maha movement, but chemicals and toxins and genetically modified alterations within our food supply, our water, our air, and then we look at the amount of emotional strain and stress we're under. It's unbelievable. And therefore, I mean, there's never been a better time to put people under lifetime care. So sometimes I hear people, there's a pushback of, well, geez, Dr. Borio, that makes sense, but you do lifetime care plans and that freaks me out or that scares me. So a couple of things. Certainly if you know, as an on-ramp with me, you could do whatever you're going to do. So stepping over to a Joe Borio Chiropassion membership, if you will, doesn't mean that, okay, I got to go from 90 days to, 90-year care plans. That's certainly not my message. And there's been many people we've worked with over the years that they've never left a 90-day care plan, but their re-signs are higher, their retention's higher. Here's the fact. The fact is, if I look at practices that have care plans of 90 days, and this is a fact. I mean, we can believe what we want to believe, but when I look at these numbers and I look at them, those practices, their retention is very low. You're only going to get about 60% of in average, I know there's unicorns, but there's about 60% of people that actually complete the 90-day care plan. That's in the average office. So just because they sign a care plan for 90 days doesn't mean they're going to complete the care plan, right? And only about 60% of people submit the care plan. The re-signs on that typically are around 50 to 60%. So of the people that finish the care plan, you're already down by almost half, right? Then the next stage is how many people re-sign the care plan. And you're only dealing with about half of those people. And then of that, how many actually stick with a wellness care plan? You're going to have drop off on that. That's why the majority of practices that do a short-term care plan or shorter care plan are always worried about new patients, because the new one is filling the hole left by the old one, the person that left. Where what I try to teach and what I try to bring to the profession is that following what I teach, the new ones will add to the practice. They're not filling the holes left by the people who are leaving. And that's how your practice grows. And it grows under a stable format, and it grows under a fun format, because the longer I stay, the better I feel. The better I feel, the more fun it is to get adjusted. I mean, some of us experience that with your family, right? You take care of your wife, your husband, your kids. I mean, that's why we love taking care of kids, right? So I hear people teach pediatric offices. I'm not saying that's a bad thing. I think that's great. But, I saw more kids in a day than most of those practices see in a week, because I never viewed it as a pediatric office. I viewed it as a family practice. Like, I never thought a child needed care more than an adult, nor did I value the adjustment of a child more than an adult, nor did I get to the point where I valued adjustment on a symptomatic person was more valuable than a person who was asymptomatic. Like, every adjustment was critical. Every adjustment was significant. Every adjustment made a difference. So when I viewed it from that perspective, from that vantage point, then everyone needed care, and I was equally motivated. Attentive is probably the best word. I was equally attentive to the person that came in and said, I feel great, versus a person that said, oh my God, I feel horrible. Like I was equally attentive on the need to get their spine and nervous system checked. And therefore, more well people from a symptomatic standpoint came in. And it's a lot more fun and easier to take of well people. And believe it or not, most well people that are on the wellness mindset, they value your care more. I know it sounds crazy, but they value your care more than the person who's symptomatic, because the symptomatic person is looking at you from a very finite standpoint. Crack me to make this go away, and I'm going to give you 3 times. Like in 3 days, if I'm not feeling better, this isn't working. I mean, that's kind of where they're at, and I can appreciate that because you're in a lot of pain and you're not being as rational. The wellness person, the person you get to understand wellness, the person that you lead to wellness, they don't think that way. They're not coming in with a finite mindset. They're not coming in going, geez, I'm coming in, looking for a therapeutic outcome right now. They're coming in because it's good for them. Like you take a vitamin, you go for a walk. You're not doing it for an outcome. I'm brushing my teeth this morning. Like I'm not evaluating that. I'm not putting value on that in the moment in a finite way. I'm saying, well, if I do this now and regularly, the long-term benefit is I'm going to be better. If I eat well regularly, long-term, it's good. I'm not eating like a health shake going, geez, this should solve all the neglect I had for the last 30 years by drinking this one drink, right? I'm not going to the gym and not going to the gym for years and then going in one day having a really hard workout going, okay, this should take care of me neglecting my body for the last 30 years. So the same is true with care. When you can get them under that mindset, when you can lead them, transfer a conviction, BJ Palmer, transfer that thinking to that person, then they're much more likely to value your care at a higher level. And if they had value at a higher level, they stay, pay, refer. I'm going to stay longer. I'm happy to pay for the care because it's highly valuable to me. It's not finite. And I'm going to refer other people. The people they refer are like-minded people. So they're going to go, wow, I'm feeling great. You got to go see this guy. Oh my God, he's great. Well, I feel great. No, I know, but my God, you could be crooked. You could have damage in your spine. Your brain's not working as well as to the body as it should be. You should go check this guy out, get checked, get x-rayed. You don't really know unless you're getting evaluated. So they start referring those people in, and then they're already pre-qualified. So you start creating a culture. You start bringing in people that are more like-minded, and that's the better way to grow the practice. And that's what I've taught for years. So we'll bring in a lot of docs that work with other groups, and they're doing short-term care plans. And my advice is, listen, first off, don't freak out. Don't change. We're just going to change vocabulary. We're not going to change protocols or procedures right away. That doesn't even make sense from a business standpoint. You know what I mean? So we would always take some baby steps here and say, listen, let's change your vocabulary for a little bit. And then let's see where you're at. And sometimes we take, we just did this with 2 practices in Europe. We went from a 3-month care plan to a 4-month care plan, and we did that for a few months, and then we did it to a 5-month care plan. And both of those practices are doing 6-month care plans. So they didn't go to a year, they didn't go to a lifetime, but they went to a 6-month care plan. Their practices are up 30 to 40%. Their language changed, and they just increased the care plan a little. I have some other practices that have been with me for a long time. They still do 90-day care plans. They've never changed it. I'm not mad at them, right? I mean, I'm trying to lead you to be bigger, better, do things, execute things in a better way, make it easier for you, make you have more fun, increase your retention. Those are the things, that's what I bring to you, and I can bring you from my experience as a chiropractor, as a coach, because now I work with a lot of different practices from all over the world. So different cultures, right? Different language, a different mindset. So that allows me a different level of insight to bring to your practice so that we can expand upon that practice to increase care plan. But this is what I know. If I adjust people one day, day one, I'm not telling you not to do it. I'm not telling you. I'm just telling you the numbers. The shorter my care plan is, the shorter my experience with you, the shorter time I stay with you as a patient. The longer my care plan is, recommendation now, I know it might sound funny. Well, longer care plan, the longer they stay with you. But The point is that you're always offering a care plan. Come in today, let's see how you go. Let me adjust you today. Let me do a light adjustment, see how your body responds. That's a care plan. And that has the shortest duration of patient time in your practice. The practice that has the longer care plan, the success of them staying longer increases dramatically. Therefore, the practice is busier. And that is the stat. The standard right now in the profession, unfortunately, is a 90-day care plan, which is typically 24 to 28 adjustments within 90 days. And again, you're only getting about 60% across the finish line in 90 days, and you're getting 50% or less as a re-sign after 90 days. And then again, they don't all finish. So you're creating a situation where more and more people are spinning off. The longer they're under care, the longer the presentation of a care plan is, the longer they stay, the busier the practice is. And again, I'll close with this. The busiest practices in profession, including today, and I was one of those. The busiest practices are the practices that have longer term care plans, that have some very structured form of education. They have the lowest overhead, highest patient satisfaction, and they have the highest doctor satisfaction. So, I mean, for me, that's what I practice, because I started from a very symptomatic practice, pain-based, insurance-based, and so forth. And for me, when I can contrast those two practices, I could say, well, I did practice this way, and then I practiced this way, and I went through a change in the middle, right? The best practice I ever had experience was when I did longer term care. And again, there's a skill set to get there, and then you baby step it if you want to go there. But longer term care, we had people that stayed the longest under care, and our stability of the practice was massive. Our volume, our numbers that are almost unbelievable, which I talked about in one of our last videos last week. And the stability of the practice. Retention, 400 plus. I mean, that's legit. Those are numbers. I recorded my busy days. They're on video. Sometimes people like to tell stories in chiropractic. I'm not saying that's bad, but I recorded today. So if I say I did something, I have a video of it so you can see it. There's some video of me seeing hundreds of people in the morning on Facebook. Just punch in Dr. Borio one day. And you'll see a bunch of video of me that I posted a while ago. And those are the best practices. So my viewpoint is, if we already know what the best practice is, let's reverse engineer it. We want to go closer to that, whether we ever get to that. Where are you now? Let's come up with some real simple steps, baby steps, and start moving closer to that. Whether you get a little closer or a lot closer, if you're moving in that direction, closer is better. And better's better in every way. Less time in the office, better connection with patients, lower overhead, less stress, more income, more freedom, more independence. It's a better way to live. It's a better practice. So if some of what I say aligns with what you're thinking, by all means, eliminate the hierarchy, make every adjustment equally as valuable. Talk to people about long-term care, that their body needs to be taken care of. A simple, real quick phase is, once I get you well, what's my job? Keep me well. How long? Rest of my life. Just getting into that kind of vocabulary, that kind of nomenclature, vernacular, and just simple things like that will help dramatically. And then working with somebody that aligns up with what your ultimate vision is. So I'm not the only guy out there to teach some of this. But I'm one of them, and if I resonate with you and you love what we share regularly, give us a call, reach out, talk to me. I mean, there's no obligation. And with us, there's no obligation really. We have a minimal standard that you have to meet if you decide, because I expose you to some of our information. So we do have a minimal standard. Hey, listen, come on over. I'll expose you to this. You make an agreement to a commitment to me, and let's move forward and see how your body responds. Let's see how well your practice responds. Let's see how well your pocketbook responds, and move forward in that direction. And if it's great and it feels good, we're going to continue. If it doesn't, that's okay. I love and appreciate you. It's always an honor to be part of somebody's life in their chiropractic journey, and you move on, you know. I'm old school. My coaches, I was with them forever. I mean, Reggie basically said, I'm retired. And I'm like, I don't care. I'm like, I don't care. I'm calling you and Irene all the time. So Jim Singham was kind of the same way. Hey, love and appreciate you guys. Thanks for your time. Hopefully you guys got a lot of, thank you, Debbie. I had the honor of taking care of Debbie as a practice member for, I don't even know, Debbie, how many years? 25 years, something like that. That's so nice that you're watching and tuning into our podcast with chiropractors. I really appreciate your kind words. Thank you for that. And yeah, so we'd love the opportunity to talk to you. And I'd love the opportunity to be part of your chiropractic journey and help you serve and help more people and have a better experience as a chiropractor. Hey, love and appreciate you guys. Dr. Joe Borio, Chiropassion Consulting.